Okay, so I'm making a recording of this. I'll put it on the channel a bit later. So let's do a screen share and let's have a look. See what we can see. Okay, so can you see this now? Can you see the files? Can you see these files? Manage participants. Can you see the screen? Yeah. Okay. So let's get on with it then. Number one, Nagesh. So first things first, let's check the word counts. Okay. 241, a little bit long, needs to be shorter. Okay, so let me put the changes on and we'll take a look at this. So I'll make it a bit bigger so we can see it. So what does the task want us to do? A letter of referral to Dr. Waters, surgical consultation, a possible knee joint replacement. Okay. I wanted to request your expert evaluation and advice for Mrs. Potter, who is presenting the features consistent with worsening osteoarthritis. Okay, good introduction. Mrs. Potter to my clinic, complaining with whole history of decreasing pain in the left knee, has not responded very good painkillers, worse off my walk. She has less pain in the right knee. Okay. I don't know if we really need that much now. And the examination revealed a decreased range of movement of the left knee, besides tenderness along with the joint, along with a joint. Besides the tenderness along with the joint, or along with what? With a joint? Joint pain? I don't know. There's no swelling, there's confirmed arthritis, joint space. Blood tests are normal. Nevertheless, don't need that. Just say the blood tests were normal. You can put that into the sentence. Dose of painkillers have been increased, if have been arranged. Mrs. Potter's relevant past medical history includes osteoarthritis in both hands. Okay, well, got hypertension, taking foreign medications. Review the above biography, assess this patient, and provide him with advice regarding the possible need for knee joint replacement. Okay, should you have any queries, please don't hesitate to contact me. Okay, that's not bad, not so bad. A little bit long. I think you could cut some of this out. You know, you could put a couple of these sentences together, but not too bad. As I say, you know, the grammar's good, right? There's not many grammar mistakes there. Preposition here, relative pronoun there. Just a little bit long. You could maybe chop some of this down and put it into a couple of sentences, for example. Okay. What's the next one? Let's take a look at this one. $248, a little bit long. Need to make it shorter. Okay. Now, I mentioned this before, redundancy. We can work this out from this. So do we really need to say it again? I would say no, because we can see it. Assessing Mrs. Potter presented with a presumptive diagnosis of deterioration. Well, she didn't present with a diagnosis of anything. You were the one who made the diagnosis, so we couldn't really say that. Who has presented with? Well, she didn't. So who you believe, you being the author, who you presumptively diagnose with deteriorating osteoarthritis. So that's not so good. That needs to be changed because she hasn't presented with that. Okay, and again, what does the task say? Surgical consultation. So you want them to consult her. Okay. So assessing. Okay, not too bad. I would have maybe mentioned something about for a possible knee replacement. I would have mentioned that. Yeah. So evaluating, assessing for a possible RBK. Okay. LB. Okay. So initially, Mrs. Potter came in. Mrs. Potter came in. This looks a little bit long. We could probably cut that down. Mrs. Potter came in as she had very severe left knee pain. Don't need that. Possessive left knee pain, which had been increased gradually. Why do we use past perfect passive, which had increased? Oh, yeah, so we don't really need that. She had very severe left knee pain, which had been increasing, possibly, over the previous year. So I would maybe make that past perfect continuous instead of had been increased. Had been increasing, or has been increasing, possibly is better. Make it present perfect continuous, which has been increasing, because it's increasing now. It's still not so good now. The previous year, especially while working. Furthermore, she claimed, well, she wouldn't claim, she simply said. A claim is when you make a statement that may or may not be true. So I wouldn't say that. She simply said. Furthermore, well, why would it be furthermore? You could have added this into this previous sentence after walking. You're talking about that. So you could have cut this down by putting this into the previous sentence. Especially the pain which have been increasing over the previous year, especially while walking and was not responsive, etc. This she denied. Well, again, that's the wrong verb. I deny having any current trauma. You know, she didn't say that. She simply said no, or nah, I didn't have any. That's not a denial as such. Denial is when you firmly say, I did not do, I did not have. So I wouldn't use that. So I wouldn't use these words such as claimed, denied. She didn't make any claim, because a claim may be false, may not be true. She didn't claim. It's obvious for her that she was in pain. So she said, she reported, she told me, she mentioned. She's not making a claim that may or may not be true. So you've got to watch these verbs. They don't mean what you think they do. Examination revealed limitation left knee's extent of motion. It was associated thinness. No swelling was noted. Again, why do we have these very short sentences? Why is this not a part of the previous sentence? Why is it a separate sentence? It's too short. The results of blood test and X-ray were ordered. Okay, blah blah blah. Okay, today's review. She has come back, or she came back for result investigations. Unfortunately, her X-ray shows present osteoarthritis is increased. Why is it present perfect? Sorry, why is it simple present? Has been increased, as well as physiotherapy is arranged. So she has come back today. Yeah. So you are writing this now. So the events you are talking about are in the past. Yeah. So was increased, as well as physiotherapy was arranged. Increased as well as physiotherapy. So I would be tempted to make this an active one. Consequently, I increased her naprox in dosage and arranged for physiotherapy. I think that sentence would work better in active voice instead of was increased and was arranged. So consequently, I increased her naproxen dosage and arranged for physiotherapy. Now that is better instead of having these two forms of passive. I increased, was increased and was arranged. Simply make it an active sentence. That would be fine. Is osteoarthritic? Well, has been, present perfect, because we've got since 2008. So, has been osteoarthritic since 2008, so we can't use simple present. You said look at the adaptation of the previous fees for previous 3 years. Given this history, I believe she requires your valuable, as opposed to not valuable evaluation as a possible candidate for ethnic surgical replacement as you feel appropriate. Okay, so not too bad. So I just watch some of these verbs, present perfect and simple past, and watch this claimed, denied. She simply said, she didn't make any kind of claim. I claim that my pain, because a claim is a statement that you are waiting for proof to prove your claim. But she said that she was in pain, so it's obvious that it's true. Why would she lie that she was in pain? Denial. You deny something. Someone thinks you've done something wrong and you issue a denial. No, I did not eat the last biscuit. So we wouldn't use that verb here, right? So just be careful there. Okay, next one. $161. Looks a bit short, far too short. 161, is that? Way too short, way too short. You need at least 180. Okay. This is Carol. Okay, well, again, we can work it out from this. Symptoms and signs are symptoms and signs. The collocation is signs and symptoms, not symptoms and signs. Whose symptoms and signs and symptoms. That's for collocation, not symptoms and signs. Are consistent. Don't forget your auxiliary verb, are consistent. The signs and symptoms are consistent with left knee osteoarthritis for knee. Well, that doesn't necessarily connect. You want a consultation to see if she is eligible for knee replacement. So Mrs. Carroll, signs and symptoms consistent with left knee arthritis, and who may require knee replacement surgery, because that's why you are sending her, because you want evaluation. Okay, retired. What's that got to do with anything? Why does the surgeon need to know this? Now, they might need to know about this, but do they need to know about that? Maybe not. Presented initially with a 12 history of worsening left knee opinion, analgesics, tennis and pressure, and a review next day or for the next day was arranged. So that paragraph's good. Review today, X-ray showed evidence of severe osteoarthritis, not just a fracture, therapy was arranged, and increased dose and an increased dose of analgesics was recommended. Review of the above, I hope compliment assessment for the possibility knee replacement surgery. Okay, so not too bad. It's just way too short. Way too short. 160, you need at least 180. So you need to put a bit more information in, like the previous one. A lot more information there. Okay, Sarah, let's have a look at this. 200. Okay, that's good. That's good. I'd like to refer Mrs. Potter, who has suffered from acute pain in the left knee for the last 12 months and requires further assessments. Okay, I would mention the replacement though, because it does say in the task, does it not, for a possible knee joint replacement. So yeah, I would mention it in the task. The requires further assessment for possible replacement. Okay, has had, very good. Present perfect. Hands and knees, 2008. Yeah, that's good. Mrs. Potter presented with severe left knee pain. Well, with this or with a severe left knee pain, which was not. I would probably make an indefinite article. I wouldn't use this as a pronoun yet. It's severe left knee pain, which is not really by medication, and even occurred while at rest. On examination, evidence of motion was noticed on the left knee, tenderness to pressure along the joint, however, no swelling was found. Again, these short sentences, it's a bit short. You could have put that into the previous sentence. It was increased. Good, yeah. All right, so again, passive, you could have said I arranged it, but okay. In view of the above, possibly needs an joint replacement, it would be greatly appreciated. Well, as I say, he's not doing you a personal favor. You don't have to say greatly or kindly, you know, he's doing his job. Not a favor for you. If you go to a consultation, take care of his patient. Okay, that's not so bad. Not so bad. Not bad at all. Didn't make a lot of changes there. Okay, here we go. Somebody keeps asking for her letter. Well, here we are. So I'm writing to request the evaluation in terms of a possible, right? In terms of knee replacement surgery for your further evaluation in terms of possible knee replacement surgery of Mrs. Potter. I would have possibly put this at the end. And again, we don't really need it because we can work it out from a date of birth, you know. Don't have to say the same thing twice. Request for evaluation, replacement surgery, Mrs. Potter. I would have possibly put that in commas then. Replacement surgery. 70 of his features are consistent with worsening osteoarthritis. Okay. Regarding her medical history, mostly hands and knees, since ADHD and 5. Condition is well controlled. Okay, I would maybe spell this out, abbreviations. Usually you write the abbreviation out first, and then every subsequent use you can use the abbreviation. So I would spell that out first, because you're supposed to be making proper sentences. Yeah. So Mrs. Potter presented with the complaints of progressive increase. Well, that's only one, isn't it? the complaint of. Progressively increase, right, of. Okay, so this needs a bit of rewording. So with the complaint of a progressive increase in her left knee pain or a progressively increasing left knee pain, we need to use one of those. Left knee pain, so of a progressive increase or progressively increasing, that will do. Progressively increasing left knee pain for the last 12 months, which has shown no improvement after taking painkillers. Decreased range of movement, a decreased range of movement. You can start it with a verb, I suppose. Has been noticed. Why is it a present perfect passive? Why not simply simple past? Was noticed. A decreased range of movement was noticed. If you're going to make it passive, there's no need for present simple passive. Just make it past simple passive. Was noticed on examination, despite the fact it was no, because we know exactly when. Yeah, we can use simple past passive. We don't need present perfect passive. In addition, again, I don't know why this is a separate sentence. I don't know why. That should be part of the previous sentence. And, well, as a matter of fact, you could put all three of these sentences into a single sentence. That's what you could do. Subsequently, X-ray blood tests were ordered and she was commenced on that problem. Okay, on the view today, X-ray report. Well, it's a specific one, so besides, we need an article. The X-ray report has confirmed the evidence was severe away in left knee. Again, spell it out. Don't use your abbreviation unless you spell it out first. Osteoarthritis. Has confirmed the evidence of severe away in left knee, in her left knee, or in the left knee. Terminology above busting away, wants a surgical opinion on with physiotherapy and increase in analgesia. Who's writing on the screen? Stop it. Severe away in the left knee, about it to a normal. What about the possible replacement? What about the possible surgery? Shouldn't we mention this? Surgical opinion. Okay, well, physiotherapy increasing in analgesia. Well, isn't that what you did or recommended? That should have been here, not right at the end. Can somebody take this green off of the screen? Whoever wrote this or drew this, can you take it off? Okay, so not too bad, not too bad. Just a few minor changes there. Can somebody, whoever put this on the screen, can you use the eraser and take it off? I didn't say draw some more, I said take it off. And these, if you please. So, let's check. $2.26, okay, not too bad. We can maybe cut some of this down. Right, where's the... Right. Okay. Wanting to refer Mrs. Potter, again, we don't need it twice. Okay, that's good. That's good. She would download on the feet. Also, okay. So usually, what you do for the first one, you mention their full name, and there's no need to put that dot there. And then every subsequent use, you use a pronoun, she, her, etc. Most common history had nothing significant or contains nothing significant. Had, I don't know why we use like had. Nothing significant, has, or use a better verb, contains nothing significant, to much hypertension and insomnia. Okay, that's good. Presented to me, well, we don't really need that. Just presented with severe pain in her left knee while walking at rest for the last 12 months by taking Panadol. No joint swaying, history of injury, reduced range of motion. Yeah, good. I advised X-ray. Yeah, good. Active. Yeah. For the case. That's pretty good. Pretty good sentence. Pretty good paragraph. Good paragraph. On review today, an X-ray or the X-ray, because you mentioned it before, so we need a definite article. I advised an X-ray. So first mention indefinite article, second and subsequent mention definite article. Detect osteoarthritis on joint space, which confirmed our blood reports were null. I recommended an increased or increasing physiotherapy. I would appreciate if you could offer expert opinion. Well, he's not going to offer. If he could give, offer means something else. Opinion regarding that's pretty good. Pretty good letter, that one. Very good. Very good indeed. 10 minutes left. Okay, so that's pretty good. We won't have time to do all these, but we'll see how it goes. What do we have here? 192. Okay. A little bit. Well, we'll see. Hey, a 70-year-old man? Don't think he is. Mrs. Carol Potter? Mrs. Card Potter? Oh dear. Suffering from a chronic pain in his left. I will make no comment. You can see. So, you wouldn't get a very good score for this because of this. His, he, his, he, his, he. Okay. Sometimes presented clinical collocations. Pin his left knee. We're walking while walking. For previous 12 months, so pain was not severe. Don't think taking pound at all. It's normal to be friend. Motion in the left knee. Secondary to his pain. Accordingly, an X-ray was requested, which showed, that's better, which showed severe osteoarthritis and decline of joint space. Physiotherapy was arranged. Well, you can see what I think about that one. Apart from that, not too bad. 219, not bad. I wanted to request your recommendation about knee joint replacement. Replacement of Mrs. Potter or for Mrs. Potter. Hands and knees. Last tip. Right, yeah, it's a little bit long, a little bit complicated. I'm writing to request your assessments. What does the task say again? If in doubt, go to the task. Consultation. Referral consultation. So use the verbs in the task. I'm writing to request. I am writing to request your assessment that you consult, or I am writing to request your consultation in or about Miss Potter, but we need to change that. That doesn't work. To request your recommendation about, well, they want you to, well, no, you want them to assess them first and then see about knee joint replacement. Osteoarthritis of the hands and knees. Well, the main issue is her left knee, really. So we don't need to put this in the introduction, just simply what you want. So like in the previous ones, to refer this patient for additional investigation, okay? Or I'm writing to refer into your care and support for blah, 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 which might require surgical treatment. That's pretty good too. I'm writing to request your further evaluation in terms of possible knee replacement surgery, yeah? So I would try and write it something like that, okay? Yes, Mrs. Potter with increasing pain sensation, with increased pain in her left knee. Increased pain in her left knee that has been worsening. Okay, yeah, that's good. Present perfect passive, present perfect continuous. In passive has been worsening for the last 12 months, as well as regular pain medication. Oh, all right. Mrs. Potter presented with increased pain in her left knee that has been worsening for the last 12 months. Okay, that part's good. As well as regular pain medication was seeming ineffective. Okay, well, we've got to change this. Last 12 months. What can we do? Increased pain in her left knee has been worsening for the last 12 months. For which she has been taking Panadol, which, however, was ineffective. So we need to change this around. This is just one way because I can't be bothered with writing out the complete sentence or paragraph again. So, which has been taking Panadol, osteo, right, that's 12 months, which has been taking Panadol, osteo, which is ineffective or however was or is ineffective. Which has been taken, and I don't know, that which is ineffective. I could write it better if I had the time and the patience, but I don't. So that'll just do for the time being. Okay. On examination, both her knee joints were tender on pressure. Over her left knee joint had decreased movement or decreased range of movement due to pain, but none was swollen. Person was commenced on blood tests, and an X-ray of the left knee was advised. Again, you've got to watch overuse of passive. This sentence would work a lot better if it were an active one. I prescribed naproxen and ordered blood tests and an X-ray. That would Be better, make it an active sentence. Today, X-ray reveals severe osteoarthritis, as evidenced by the presence of osteoarthritis in the left knee. However, blood tests are normal, or her blood tests are normal. She's hypertensive. She is. You mean she has been. Make it present perfect, connecting past and present. Not present simple. She has been hypertensive for the last 3 years. It is well controlled, and is well controlled, which is, I would make this, I would use a relative pronoun there, which is well controlled instead of it, which is well controlled with medication, or controlled by. I prescribed a facility and has, I has, you has, you mean you have. Augmented analgesics. In view of the above, my diagnosis was in the left knee, and I appreciate it if you give your valuable opinion, if you could give, okay, your valuable as opposed to your worthless opinion, or simply your opinion about a possible left knee joint replacement for this patient. Okay, not so bad, not so bad. Please not hesitate to contact me if you have any queries. I might have some queries, yes. Okay. So, I got time? No, I haven't. Less than a minute. So, I'll have to go. I'll come back. I might have time to come back later. This will end in a couple of seconds. So, if you haven't had yours done, I'll try and do it later when I've got time. I'll be open to questions on Telegram. I'll do these 2 letters and post them there.